Well, in high school, my science advisor had recommended that I become an orthopedic surgeon because I was into sports at the time and really enjoyed science. But once I was in medical school, I gravitated more towards ophthalmology, where there were lots of new emerging technologies at the time, LASIK and new premium lens implants. And I thought that that was better captivating my interest, and that I could have a better impact on patients' lives at that time.
Growing up on the farm, I was really always interested in the eyes of the different farm animals, and so as a young child I became fascinated with that, and shortly thereafter I had an eye exam and realized that the eye was something special that I wanted to begin studying and to become an eye doctor.
Well, I came in and they did all the preliminary testing here at this office and told me that I'd be a candidate for clear lensectomy. And they were going to put the auto-focusing lens in my eye so that I would still have some focusing ability because I'm 48 years old. And after that, it was time to go to surgery.
Some ophthalmologists just perform cataract surgery or just perform LASIK, but I like to do many different subspecialties within ophthalmology, including anterior segments such as cornea and refractive. But cataracts and LASIK and oculoplastics are mainly the surgeries that I do.
I had very saggy eyelids, especially around the corners of my eye. I mean, to the point where it seemed like shadows were coming up behind me. Cars were pulling up beside me that weren't there. He did the surgery and took all that excess skin up and out, and now I see much better and don't have those shadows any longer.
The partnership works because he's a surgeon. He enjoys doing surgery. What I enjoy is doing pre-op and post-operative care, so we work very well together as far as managing and taking care of the patient through the entire process.
I applied to several locations throughout the country and was fortunate enough to be accepted to the Tulsa Ophthalmology Residency Training Program, and it's been fantastic. It's a great opportunity for me. With that opportunity, I was able to perform more surgeries than really all the other residents combined in the country, and that allowed me to develop skills earlier, I think, than many other ophthalmology residents and or early ophthalmologists.
I actually thought that I had a bad pair of windshield wiper blades on my truck, and I replaced those, thinking that would take care of my vision, but it didn't.
I believe Eye Care Associates offers kind of a premium service for patients in the eye care industry. We pride ourselves in having a service-oriented, comprehensive eye care in a timely fashion.
I mean, they are first class. Dr. Langley's an excellent surgeon. Like I said, I had absolutely no pain after the procedure.
Oh, the next morning was totally a whole new world. I couldn't believe the difference.
We have a family-type atmosphere here, so patients, you can go to any eye doctor in town, so we try to specialize not only in the equipment we have and the ability to diagnose and treat diseases, but also to have a friendly staff that makes them feel warm and welcome when they come into our office.
The staff, everybody, they were all consistent in what they told you and the care they took care of me, so I was very pleased with the beginning, middle, and end of the whole process.
I've worn glasses since I was 7 years old. I've never had really good vision, but I started having real blurry vision, so I knew I had a problem, and I just avoided having anything done. He just told me that there was nothing to it. It was just a very quick procedure that they would remove the cataracts, and I would just be amazed at how I could see, and he was exactly right.
You know, it's not so long ago that when patients had to have cataract surgery, they had to make basically an incision that encompassed half the eye, and they had to be in the hospital for 2 days or 3 days and with sandbags on their face for that whole time. That wasn't very many years ago, and now we make a tiny, sub 2 millimeter incision. It's a self-sealing incision, so there's no stitches, there's no blood, and the patient's able to see immediately after surgery, whereas before the patient had to wait several days, sometimes several weeks to see clearly after surgery. So it's very gratifying for the patients to see clearly immediately.
I could see, and I couldn't believe I could see. I could see numbers, and I could see the clock, and I see things I hadn't even seen before, and it's wonderful.
Yeah, I think one of the things special about being an eye doctor is giving back the gift of sight. To me, our one-day post-ops when Dr. Lanny's done cataract surgery and I get to have the experience of the patient seeing 20/20 and experiencing that vision with them is very exciting. Fixing vision and maintaining vision, which is one of my favorite senses, is one of the reasons I really enjoy our field.
I would say that I was probably stupid for waiting so long, because it's life-changing. It really is.